Iqaluit. Good morning, everyone. Today is Tuesday, February 8th. My name is Sima Sahar Zerhi. I'm Premier Akeeagok's press secretary. We are going to begin our COVID press conference today with a short statement from the Premier, followed by a statement by Minister of Health, Minister Main. And then we have Dr. Patterson, our Chief Public Health Officer, Minister Akeeagok, Minister Gross, Minister Nakashuk, and Minister Joannesi available for any questions. And thank you again to Uli, as always, for being our amazing translator.
Wala sa kullo minagajaw laki February 8 tana sima sibulaktiud people le ayo laki na motitiraktinga pigya ko taham na tugutan na kala makhala ni Minister May no kala malang ameyok tabani tu na ham na ito laki marik Dr. Patterson tako Minister Yovani Mayuit Minister Akeeagok, Minister Gross, Minister Nakashuk Malo, Minister Joannesi.
Kuya namin si Mama Uli. Udlakon tiapa ka Nunavut mute piluang waktu me inya kuluin. Udla nalatun. Udla ngoyo nalunay kung nasivugo Nunavut iluane 366 ngoyo. Nuwan no druamo nalunay tao si mayon. Takwa katitlewe 18 ngovo nunalain atok tao si malutun. Avitok si maningin imeding avon. 16 Apvianen, 18 Kamanitluamen, 18 Cambridge Bay, 2 Iqaluit, 11 Sadler, 38 Iqaluit, 130 Iqaluit, 1 Johaven, 0 Kimmeron, 12 Kingen, 0 Kuwatuk, 6 Kolokto, 0 Nauyan, 5 Panokto, 6 Mitimatale, 4 Iqaluit, 34 Kangatlene, 9 Sanaraya, 15 Sanikilua, 38 Talodruak, 3 Tikirajuanitum. Nalunerun Naksivu Tau, Nuvan Nodruakasugayo, Tishaman, Kauswitumen. Katitlewitaqua 196 ngayon aniguishamalotum Nuvan Nodrua Udra ngayon Katilima. Yeah, there's an echo there. Echo kung avane bakayo sinamnarama kanukungman. Katitlewitaqua Udra ngayon 196 ngayon Nuvan Nodrua harunutum Udra. Katilimar lewen 971 ngayon Nuvan Nodrua haron sumayon katilimar lewen tana Nuvan Nodrua Nunavut mo isidaw sumatidlewo piluang wat mo Omicron kay titigakan na rumabungan Nunavut miutane ikayuti sanok play si magatam tukisigaw yung nakatatlo Nuvan Nodrua pidjutigidlutigo Nuvan Nodrua hakasugigoven Iqaluit koven uvalon khusukata koven tana COVID hotline ukalaw te akirangit tukod sa novesi magata 1-888-975-8601 ukalaw yung natiyato ukala ko yakata pugwilam takwat ang ikasima ko yon nikin yung Iqaluit yung narotin sa novesi matiyam megata ukala yo kwa natiyato tasimo 1-888-902-0872 uvalon kakasaw yakon titiraveuluta isolationSupports@gov.nu.ca kana yaktivo atwin na piapotako nga ikayokun na kudlutigo Nunavut mute tusirato tasok takonunga amatana apakotegiyawen na hatamma nunalin asingin non outdago mayon ukalaw te kami gata apakodisakato kamnerone akikangito tamanna 1-833-524-0735 kay titiga ako mabunga Nunavut mutane tana uluwan na tume kung itiakat tigo Nunavut mute piluang watume inya kulubun kitong wabun amanuna livo tabuna pinopanguma kapoktagun namnitigon kapoktagun natum kapoktaulen amatakwa luta Patterson atulako katasimayangin atwin nadlutigo ang ikasimagun nakove ang ikasimalusi inun Nunavut ila pekan na yan ni amisuluato ni kata kuyaw kata si manginita ang makina mo matuwa si makatay na kuyaw si manita malin na lewin. So kuyan namin. Udlako to the many Nunavut that are listening in this morning, especially our elders that are listening in. As of this morning, Nunavut has 366 positive cases of COVID-19. We have active cases in 18 communities. The reported numbers are as follows: 16 in Akvian, 18 in Baker Lake, 18 in Cambridge Bay, 2 in Chesterfield Inlet, 11 in Coral Harbor, 38 in Iqaluit, 130 in Iqaluit, 1 in Joe Haven, 0 in Kimirun, 12 in Kingay, 0 in Kugaltuk, 6 in Hotlukton, 0 in Nauyan, 5 in Panukton, 6 in Pond Inlet, 4 in Qikitatjuan, 34 in Rankin Inlet, 9 in Sanagayak, 15 in Sanakilua, 38 in Talotjuak, and 3 in Whale Cove. We have also 4 presumptive cases in Resolute Bay. We have 196 reported recoveries today. There has been 971 total reported recoveries in this outbreak. Once again, I wish to remind Nunavut of the available COVID-19 resources that we have made available. If you develop any symptoms such as a runny nose, cough, sore throat, fever, or have difficulty breathing, please call the COVID hotline at 1-888-975-8601. And if you are isolating because of COVID-19, you could call our toll-free number 1-888-902-0872 or email isolationsupports@gov.nu.ca to access the Government of Nunavut isolation grocery hampers. Also, for those with travel-related questions, please call the Government of Nunavut's toll-free travel line at 1-833-524-0735. We all know that the best way to protect ourselves, our elders, and our children and our communities through the vaccination. Please get vaccinated and get your booster shot if you can. As always, continue to adhere to the public health measures. Stay home when possible. Stick to your small bubbles, as well as wear your masks. Kuyan namin.
Blachak tema man no yo nuna de 22 nuna bu ido ani nuwang na ra khang na to hima mata ublang yo ekai ti ti wa tunga nuna bu Munich tu ki hiti ti wa tunga lo an ate de ti chi ku bluta amalu gavo mau bluta piuna ni lil matin ik akorapta pilerigapta kanwing itcha ko inang mut ama ikayong ni lukluta Nunavut miuni akong na tu ko alwat yuta pilere bugut manna ikayok tikak kanang ne kanak suta yakanayak tinik anya siutinik na yang ngwani at nate dit chikut anok kahoitumik pilere ne kakput Pilare kaktak tu lare niumik kanut kablunati tu recruitment kanayak ti kanang nik kini nayak tu gut na yang wa kanang nik lu kanak suta kabumatokakut ikayok himayut uwap tinik makong nik na yang wa nik audlay himak matanuna bumut ako akang yak sinang mut tukak ti tau himabluti makuk Amalu Canada mit Red Cross good. Ikayok himawut. Na yang nguanik akwinidignik. Aulay himablutik nunavumut. Aulay niyak himablutin nilak. Ako anuwang nalruada kanyang mut. Pilakititaw niyak lutik. Igluling min. Kamanit tuang min. Talok nilo. ta ko nunalin at toktaw himanak pangup mataman na uyok Iqaluit hilatanik ta ko nuwang na luwalakan ng munahaw ti takublugit taman na tao pilakayakit miyabut akyakang ito ukalubikak kablunati do COVID hotline kilam mi kanin na kakut kiuyaw taktuduang na mata ukaluk kimayut amalo kawi haktaw yakeli kawi haktaw lakinak na mata taman na pilakayakit miyabut pilakayik kanang ni tay ko nga ili hinilukluta Iqaluit tu tiang miut tema okaw ti huak sugid loob lang uyok akok migapta na tayliti chiku bluta inutokaw hivi nget tamik kanut kanuing itya ko inang mopilari gapta tay kani uggonak tu galwa Iqaluit tu tiang minutokaw hibigiyaw yumik uggonak tu galwa man namutikit sugu 13 pilari giyaw yut amalu inutokaw yut nuwang nalrakang nakaktaw himalak mata man namutikit sugu ugong nakalwak ti ugutaman na kuya hukto nga inutokay day kanihok tuluktat kapiyaw kanik himak mata nuwang nalraman elagay kutaw yumut amalu pingayugi yanganik booster ngunang aktaw yumik kapiyaw himan ni kublutidlo taman na ikayong nakaktaw himayok kanuing itya ko yinang mut iko inutokay Mikan amalo te kanino to kaw hibing mi pilari kat chang nakaktaw himayut pilari kang nakayangit kanuing chang nakaktaw himayut man namo kingulak pamik mat na ako lakay klugit at natay chijik ko pilari yit kap yu lakay niyang mut pilari himakla mataman na mutikit sugu nunabumyut kapiyaw yulo ako blugit nuwang nalroang mut at nilagay kutaw yumut December 21 ming pigyak sugu man namutikit sugu ukwa pilagay ikotibut ikayaw luak himak mataubuna hibut lakpamik kapiyaw himan niku blutik 2,370 tuglagay yangani kapiyaw himan niku laksutik 2,000 tamanya kanigiyanik amalo nunabu iluan iman namutikit sugu pingayugi yangani kapiyaw niku himayut booster mik 12,520 tumakwa na how ti kaw herigyak sugit kuya nadlakik tu mat na tiyamak papi kuyan na mi kuana piliriyu yuhi amma pinilkalwak tu nga kiheni kaputit mikano ekaitit siya lagak langa Atuin na uyut nunabumiyot taluktanut 5 amma ungatani ukiulignut amma amihuni kap yuinit mass vaccine clinics man na hakik padlagaw yak nunabu ilwani nunaling na jiging itunik takwa ukiulignut 5 min 11 mutoka ngayut takwa kap yuinit inung ni amihunik takwa ulokaya nang nakangitut kaputit ikayong nakakluak sutit lukaputit ati kapiyaw ka nakakang nakubit hibudlapaw yumik ubaluni pingayugi yanganik ati tekwa kaputit ikayong na matailit nik tigulaw kit amalo kanuing ityak pala ko taw nak sutik nuwang nalrame ungatak tisuta nunabuiluani matna. Good morning. There are now 22 communities in the territory with active outbreaks. I want to reassure Nunavut that the government of Nunavut and health staff are doing everything within our power to provide care and services in this stressful time. We are working to get more support on the ground. Health continues its recruitment efforts to hire more nurses. The federal government has assisted with resources, including 2 nurses for Rankin Inlet. The Red Cross has also provided assistance with 6 nurses to assist with COVID-19 response in Iqaluit, Baker Lake, and Talolruak, the communities currently with the most COVID-19 cases outside of Iqaluit. We are also working to increase staffing for the hotline to help reduce wait times and ensure timely access to testing. I also want to assure the people of Cambridge Bay that health is working hard to care for and protect the elders at the Cambridge Bay Continuing Care Center. Unfortunately, there are now 13 people, staff and clients, who have tested positive for the virus. Fortunately, all elders at the center are fully vaccinated and have had their booster, which will reduce the risk of serious illness and hospitalization. Staffing continues to be adequate at the center. Finally, I'd like to thank our incredible teams of staff working to vaccinate Nunavut. Since December 21st, they have administered approximately 2,370 first doses and 2,000 second doses of vaccine. Nunavut has also delivered a total of 12,520 booster doses to date. To those staff, thank you so much. Just incredible work. A friendly reminder on the vaccines: they're available to all eligible Nunavut, and clinics for 5 to 11-year-old second doses are rolling out. The vaccines are safe, the vaccines are effective, so please, if you're not vaccinated, please get the dose or doses that you need, as this is a vital step to reducing harm from COVID outbreaks. Matna.
Kent Driscoll, APTN National News. This question is either for the Education Minister or the Chief Public Health Officer, depending on how you guys want to go about it. The question is, the middle school in Iqaluit remains closed, and the last time an Iqaluit school closed this long was in 2008 when there was a sewage smell at the Akeeagok school. Back then, they split the students up and sent them to different schools while the school was closed. What I'm wondering, is the COVID response the reason why these kids aren't being taught in a different location yet, like what happened in 2008?
Kent Driscoll, APTN connected na khitiani to no ilinang nilino matumamat swalo sunang ni kungano kingula pa mi matuyo kalaw sa Mayo 2008 nakashuk tay ma kinalo sunang ni ngano ilinang binulasing ino ilinang tayo hatalaw to manalay no kadyo na pijutigil tay ma kako ilinang tayo ngilasing in.
Juana, for the question, I can say that unfortunately the school is closed. Akeeagok Middle School is closed due to issues with the fuel. I know our Minister of CGS, Minister Jonassy, can answer technical questions. And we're working to solve the issue, and we can speak further later on the situation. And we do know that there are many departments working hard to ensure that our students go back to school safely. And I'm prepared to speak with the stakeholders tomorrow. Hopefully we can find a time to speak and discuss the situation and all come together to work on the issue, and hopefully our students can go back to school as soon as possible back to the middle school. Juana.
Kuyan na may aparigon na kabe karon naktungog naktugal watay naksam na khitiani to no ilinang nilino matumamat uswalo le uswalo sunne ngano pejutigil logo tay nanunalin ni gava makkungin ni lupit sratik kun Minister Jonassy o kiuga kan nakto ilulengin ni tamana kitaw ga swaktu galwa kamala mesu gava makkun ni pili ringi pili hatigi sa to terun nakse khulugilin na be muatan ang itoko khapata nailo khataw galin nasingin ni timio yune katima hate khala to tamana kitaw ga swakul logo tay ko alo hilamio yukuti run nakhulugilin nakte.
Minister Gross, you didn't even try and answer my question there. My question was, is COVID playing a role in the response? Is the reason the students haven't been sent to another location COVID, or is it simply that you haven't done that yet?
Minister Gross, kaya katangin na biyotan na nukad yun apit yung tigil kwa singin nuilin na titaong ilan.
Juana, for the question, and thank you for asking that part again. As far as I'm aware, it is not related to COVID that the students haven't gone back to the school. It is the fuel spill that is the reason for the closure of the school, and the Department of CGS, WSCC, Department of Health, and the Department of Education are working hard to ensure that this emergency is fixed and repaired as soon as possible for students to return back to Iqaluit Middle School. Juana.
Taman na pidyo ta hangit no badyo anak tulay ng mutan tayo na leo so alo mikubiyo ham ni ano tayo na matuyaw si malakayo gava makupili ringi nunalin ni gava makunin lupi swati ko tay ko alo kana yapti nunalil kumala ko amalo ana ham nang itulay ko ilin na tulay ko lo at suro ta hakto tagam nakto ko tay ko ilin na ti utro nasila ko lugyar sang nimo.
David Van, the Natiak News. Can you tell us which communities have the hospitalized cases of COVID-19?
David Van, the Natiak News. Kunni ko ha nakina lani nunalid ni nga samayo ana bimi unit samayo kam mga tanu badyo anak tuli.
No, we can't. The number is still too few. It's 5 or under in all communities.
Agaw hakod nang ito sulihat sina ulo ang atatako tali may tungani mata nunalin nga samayo unit siman yali.
How many COVID cases have been reported at schools?
Where?
Schools.
Hatsin no badyo anak ta samayo hak kanalo na taw samayo nailin na binni.
It's impossible to answer that accurately. Oftentimes when we do contact tracing around classes, we find that students who attend a class together, many will socialize together, and teasing out whether the transmission happened in the classroom or at those social gatherings is impossible.
Taman na kakachawit sa ato kiyo kaswalago tako katiyaw yung minang nakawi sa latilog ilid na katingin ni ilid na ati tako ilid na katigi kalo ato ilid na biyo sila tani no katigin na mo kating nga katamay mata tayo may manalo na ato nalani sa mabiyo ng mga tayo ilid na bimiyo balo sila tani taman na kaya nalo na ato.
Teresa Khachuk, CBC News. This is for the CPHO. Is it recommended that children who may have been exposed to COVID at schools isolate, or is it mandatory for them to isolate?
She could speak in it.
Takwa nutakay siya view patay linder vinne inutu titaw hozaw tu inakaw balone inutu titaw gyakaka.
If they're identified as, if a student is identified as a high-risk contact for COVID-19, then it is mandatory to isolate.
Lalo na tayo sa mayo hakailin na optimita mahulog ang optimin nga ni kataya haktumin nga ni takwa asa go behang ito ko ni tele ko yaw katakto.
In Nunavut, we are still classifying student-to-student contact as generally as high risk. We are following what's happening in other jurisdictions that have reclassified that to see the differences in the transmission between students at classrooms to see if that's still necessary.
Nuna bumi sulita ko nalo na tayo sa mamatailin na aptiyo katiminita ko sa mabimini uyulo ka na tumigo ti hamning ini. Asing ini ka na tamin nalo na tayo kan na simalak tayo galoas adjiging ito ko.
Siya makbiyo gay matatak ko Dutakat ilinya vinni. Tana toa inututi tau khatak to ani kanginni summa ilagi tabbani illungani ilunati inututi tau khatangila. When a child is told they were exposed at school, why do they have to isolate and not their whole family?
It gets back to the discussion topic of contacts of contacts. If the student has been exposed but is not symptomatic, has not been diagnosed with COVID, then the risk of their family spreading it further is quite small. Yeah, it just gets back to the general principle, contacts of contacts don't have to isolate.
Tanau tuin nak pitai mana kau sio kau yu mutakku katiya miniu yuni katiya hatuin nak tu miniu tidlugi so loilin nak titsiji katiya hap tu miniu galo am nak tau lu ni khanui guti khangipat nalo na tau simangipallo nuwa jo nak to khamninga ni ta ko ilangi uluga nak tu bigu te khaluangi mata sa makbigun nang ningin ni.
Trevor Wright, Nunavut News. Lots of recoveries today, particularly in Iqaluit. Is there any particular reason for that, or?
Trevor Wright, Nunavut News. Kuni tako misu kanay gunir naktaw mata misu nakpangulut iglulik ni kanay gunir naktaw yu taman na kano pidyo mga.
It's partly the cumulative effect because there's been no recoveries announced since Thursday morning. But it's also today is we're into that period of 9 to 10 days since the explosive growth in Iqaluit was first identified.
Explosive?
Really fast.
Ilang atamak ko ano palya sa mamata tayo manalo na tayo sa mayo kanay gunne ko ta palya sa mayo sa tamang minyo ka si ulong mata amalo ulumi tayo ulunik 9 nik 10 not no ba jo nak tulir kanay gunne na tayo gunak sa mamata tayo ko ami sui katitugi pigya lalaw sa man kung inno.
Next question is for Minister Main. As some might know, the city of Iqaluit's vaccine mandate went into effect yesterday. A few people out there are making a distinction between being anti-vaccine and anti-vaccine mandate. Is there a distinction in your mind between those two?
Tako kaya malagat sidik kungin ikalun Isip to kami ato akailok jo ako tingin no nami tuwin na kanayak bingin nulo ni kapiyaw si maluti kisya ni ulang ngailang inulo ko siyo katalanga tako akiraktok ningin ni kapiyaw si mangito ni kamalo kapiyaw si mayo ni kanong itaman na isa magibiyaw.
Thanks, Trevor. I support vaccine mandates. And I think they make a lot of sense, but I'll try to answer your question first. So, do I see the distinction between being vaccine, anti-vaccine, and anti-vaccine mandate? There might be a distinction there. But it seems to be a bit like splitting hairs. I don't see. If you are not anti-vaccine, I honestly don't see any issue with the vaccine. Vaccine mandates, I don't see any coherent argument against vaccine mandates. The arguments that I do see put out against vaccine mandates are quite often based on misinformation, such as, I'll provide one example, such as, the city of Iqaluit should not have access to my personal health information. That's what somebody who's arguing against a vaccine mandate could say. And the response is they don't have access to your personal information. They only have access to the QR code, and they can scan the code, they can look at the code. The only thing is there's very limited information that QR code provides. So I guess to wrap it up, I fully support vaccine mandates. I'm very thankful to all the municipalities and the city of Iqaluit who have brought forward vaccine mandates, encourage more hamlets to go that route. It's a team effort in terms of trying to get more Nunavut vaccinated. It's the government of Nunavut, all their different departments. It's the Inuit organizations with their awesome incentives that they're running and the support for vaccinations that they're providing, and also at the municipal level. So if we're coming at this from a team perspective, I think that municipal piece is very important. Trevor Dan apik ko tigiyat kapiyaw yakakang ni nunaling ni iglo ko tigiyaw yun itek ni luksuni taman na adjiyungit mga kapiyaw yulakin ng akiraktok niyang mut katamak ko adjigi mga ta adjigi mga ta apikilaw kabit imaka adjigi nyak takak tu galwa kiheni mikiyu gayang oyak mataman na aywad jutaw ni luktak tislugit tamak ko kapiyaw yakakang ni udjiri himagakku tamanna akiraktok tu tamakkuninga kaputinik ubaluni kapiyaw yakakak ningmi akiraktok tu hulingitunik atokayuk mata tamanna udjiri himagakku hulingitunik okawhangnik atokayuk mata akiraktok larangata uktu tekaktu luak sungalu uminga nunalipaw yakku akiraktok tokangwa kayakpat okak kinakayak to nunalipaw yakku takku kangunak tunik ata ilitit sinang motoka ngayunik takku yakakang itu nunalipaw yakku kiu yu lua kayagaka takku lang itu kangunak tunik teko nalunay ku tat kapiyaw himan niku nakay jutit proof of vaccination kangunak tunik ilulikang mata takku yaw galuak patakinamiamut kangunak tu kau yang mayaw yakakang itu inukatik nu takuyaw ni ayok matateku na kiu na yak pakataman na ya ikayok tigi tuluk tao gap ta kapiyaw yakang neomik kanut kowehud lakik tunga gabuma uduta abik tok himan ni kayaw yu tamap ta pilere katigi kapta amalo nunavutung abik inuiti me kotingi pilere katikak mata ubat ni amat nak himang diwak sugit amalo ham lagi yaw yu nunalipaw yakulu pilere kataw mata ataw hang mo pilere yuluk tao kapta taman na kowehid lakik paka nunalilu atuin atulak ti himayu kapiyaw himaya kakang nang may vaccine mandate min mana mo tikit sugo tape ko nunali mat na lakik sugi ko yan na may ikayo kape.
Mathieu Sarvé, Radio Canada. My question is for Minister Main, so can stay. Can you, just to go back on something you've said during your statement, can you elaborate a little bit more on the additional nurses that have been deployed in the 4 communities that you mentioned, when they arrived, how long they'll be there, and in which other communities you'd be potentially asking for more staffing?
Mathieu Sarvé, Radio Canada, kunin fakkago bitako hanna surte mitsano. Nalunay rekan ni runa rubigi so lo kanu tigita mani na mga ta kangalo tikin na mga ta.
Those are those decisions are very much operational based. So they're when the request goes in, at the time of the request, the operations division puts in where the staff are going to go, or where they're requesting for them to go. The timing is very dependent upon the individual's ability to travel, and so it can vary by up to 5 or 7 days as to when they actually travel.
Tako isumaliho tao yawalat sino tamako isumaliho tao hatangata solo tutsirak to hatumini utilugu tako yawalat sinang mo piliri jengit lalo na sa katangata namungang na mga tao balo namungang akalaking mga tao hangak po na amning ilitako solo awla ko namning imalitugi tako tikiti tao yulo ni 5 ni 7 no ilan ni kutako nunalin no tikit palat yung nakatakto.
The work that they do is entirely, it's directly related to COVID response, but it could be testing, it could be contact tracing, it could be administering vaccines, or all of the above, depending upon what the community needs.
Takwa le khanulir ner yangi takwa naluna ila atigi khatangitu ila no pajwana tulerina motora nga yuin nay su lu khawi sak khatang khata ubalu ne katiya yuminam ne khawi sak na khata kapisi khatang na khata lo ne takwa lo ne lo nati ilu nangin ni pilira haraw nakto malittugi khanotigi nunalin ne kayakto ya kharningin.
Can you tell us how many of the 19 people hospitalized at the moment are unvaccinated or not fully vaccinated?
Takwa 19 uniksima yui khatsi ukaw naki nalla kapayaw sa mga kapayaw sa mga talon.
Good question, but sorry, no, I don't know off the top of my head.
Siya ba ugalo kasi ani ukaw nangita ka ila ukaw mangita ka.
This is a question probably for Minister Main, since I don't see Minister Lightstone here. I'll wait for you to get up. Minister Main, just now when you were talking about the team perspective for a vaccine mandate, government of Nunavut's a big part of that team. I'm wondering where's the government of Nunavut's vaccine mandate for your own employees?
Takwa ila kapiyaw ga hasimani ray luti takwa naluna sisimani raptilogi takwa likia kanunu na buga ba makungita matsuminga naluna sisimani akha kapiyaw simagya khalari titsinaka.
Man nakyan aperigovit tamat tuminga at nataliti chiku bluta atulak titi himayuguti tumik kapiyaw yaga kang naray himabluta pilari kotit tinnik Pilari looked up tit no taman na toka nga titaw bluni January 10 me piga atulak titaw law bluni man namo tikit lugu tamani 46% pilari kotibut nalunek kutang mitnik kahit himayut taman na nahaw kop makpad lagaw yaktok pilari yaktik yuta abiktok himanirayap ta iluani kihenita ko gavamakut abiktok himanirayang in ahingit pekhotiga qora bigit ilina tulerayikut ekatwe yulerayikut tamako pekhotiga qora ni anate diti chikun winna kiu ni ayungi takatamanna so Thanks for the question, Kent. And so the Department of Health, we do have a vaccine mandate in place. It came into effect January 10th, and our numbers to date show that 46% of our employees have submitted their proof of vaccination to administratively, and that number continues to rise as we catch up on the administrative side internally within our department. We have a lot of other priorities right now that we're working on. But in terms of other departments beyond the Department of Health, I really can't speak to that. Looking at education, justice, it's not my place to speak to the other departments. As Department of Health, we wouldn't be ordering other departments to put in vaccine mandates. So, thank you.
My next question is also health related, but it's a little more on the technical side. You might want to tap in Dr. Patterson for this. Public health nurses here in Iqaluit are swamped right now. We have the largest population in most of the cases. And so much so that regular programming like the Well Baby program and tuberculosis clinics are being affected. What I'd like to know is just how many regular programs are reduced under this current status, and what's the eventual plan to fix that?
Takwa anya siuti tamani khalunni piyat sahatulari ulangata miswalo gatta tamani khalunni tamakwa pilirang uga yuttu nuqapti taw simahattalangata sulu piaga khawi saktaw khattarni amma puballun nartulerin takwa hangakut ila piyat taw kannerunala khamana yub kanna taw simabahangakut tamakwa wala taw uga yuttu piyat taw kannilamni.
Thanks, Kent. We're in the process of mapping out changes to contact tracing because the universal contact tracing, trying to contact trace around every case is pretty much impossible with Omicron. The national and international consensus is increasingly that in most cases it's not the best use of resources. And hats off to the staff who have been working really hard to try and do that, but as the cases have grown in the last week and a half, it has started to impact the other health maintenance programs like routine vaccinations and in some cases contact tracing around TB.
Dalu na yakta valle ana langata sijikta ulam ningi takwa khawi sakat ila hawi kaiga so talam ningi katiyaw si mayunik tayma nunab jami tamakwa khawi sakat tam ningi katiyaw si mayunik tayma ayok nanga pilok tumi Omicron sama palia sulari uningano kana tami nunab jami lo tayma dalu na si valle si malangata tamakwa piliri jutit sa khangit lo amni kumu tayma tu tikhat siangin nakaktaw man Teko hoyagi jagalo angat suru tikhap tu tamani katiyaw si mayuni khawi sa khatak tu tay ma pinaswaro si ataw si abbarlo si mayumi pijat sa hak tu mariw si mamata at tu si manay halak tu nilu tamak ko nga singin nana hamnang itulirin ng muka magiyaw gyalid nik surlo kapiyaw gyalid no asingin nur abbalo katiyaw yuminang ni khawi kay khatak ni puvalon nak tulid ni katisi yuminang.
In the coming days, we will see a shift in many communities to moving to an approach where we use contact tracing to protect the most vulnerable settings, so sites of congregate living and critical services, and much less reliance on contact tracing in other settings.
Ulugalaw na ito ni tamakwa si Zupalya na alatino na lid ni tamakwa tutaw hatam ni khano kati si yuminam ni khawi kay valya hatam ni takwa sibulya pa titaw luti uluga nak tumigom na nakpa takwa piluang wa ko taw ni ato tamalo kating ngayon ilumyo hatigi giya hap tu tamakwa lo pijit siraw taw giya khalakitut asingin ni tay ma khawi kay lo khatal lo jagun ni tu kati yaw si mayumini ugalwani.
David Venn, and Natsiak News. I believe this is for the Education Minister. How has student attendance been on average since reopening a couple weeks ago?
David Benunat Sound News kung ni hano tigilin ni ati upakat tigit ni ayun na sa mga makubin sa ako si matoy kan na si malak tilugi.
One further question. We encourage all students to go to school, whether they're in the 50% or 100% back to school order, or if their school is closed, we look forward to them returning back to school. Right now, the week of January 24th to 28th, we had lower than normal school attendance. And based on the overall statistics, we have between 21 and 29% lower than average. So for each region, in the Iqaluit, 29% lower attendance, Iqaluit 27% lower, and in the Qikiqtani, 21% lower. So, okay.
Tako ayaw tu napakalaw wilin na ti upagyat upaytsangin na hatakulugi na binut. Tako abangin ni matuing atu nakalaw tilugi balwatang yung 100% ni matuing atu nakalaw tilugi matuing atilugi niriut siya tu tako utilam ni amalwilin na nakalaw tu January 24 mi 28 mo. Tako hatsin na si mayo pa hatak tu tako 21 mi 29% mi tay makatat si mayo pa hatak ni 29% kitam ni 27% kivaler mi hikatalo 21%.
So there could be a number of reasons for the lower rates of attendance, including students who are at home isolating or staying home due to COVID-19 symptoms, or also staying home due to fear.
Nakading ito na ipidyo kakatakto upakatangin ningilin natin ang kasimayo. Ani taili ko jaw gamilonit upalonit no ba jo anak to ha gute hanoy gute hap to take upalo kapya to inang nang mo lang yung pakatang ito.
If a school opens up to 100% capacity, will teachers still provide at-home learning packages for students whose parents choose to keep them at home?
Ilin na beatang at 100% may macho ilagalo at ilugita ko ilin na atit sa jeng yang ikaw tigat sa ni suli ilin ang kami ni ilin na ako tini suli ato na atit sa katalakan.
Kwana, for the question about learning packages, if students decide to stay home, it is a shared responsibility, and I believe there is instances where students do have learning packages created and sent home for them.
Ako ilin na ati ang kasamanya katata ko ajiging ito no taman na pileret sa yok sulo ang kasamanya katata ko ato na utitaw to na ato na utitaw gunak to ilin na utit sa ang ikaw tigarni.
Yeah. I just wanted to add on the issue of schools and concerns from parents. We are hearing that concern, and as the Department of Health, we're receiving inquiries from elected officials and parents on this, and we understand that it's stressful for many parents, and it's a very stressful time. I just wanted to encourage parents who do have that concern for their child's health to please have your child vaccinated for COVID-19. The vaccine clinics are ongoing. Right now they're in Rankin Inlet. There's a mass vaccination clinic. Generally, my feeling is if the vaccine is good enough for you as an adult, you should also provide that protection to your child. That's my personal feeling in terms of pediatric vaccines. So I'd really like to encourage parents who are concerned to get your child vaccinated. And we have vaccines available to all across the territory, or they will be available in the coming weeks.
Angayok kakayaw unik ubalunay ni kawaktaw hima unik. Apekayaw gayuk higapta ilin na tulikan yung mikanut. Tukihiya yugut angayok kakayaw yut ihumalu te kakmata malu ikping niya kayang tuhak hematyak tutigu. Ayaw tukan nakawak kanak suginip yakawak tunga. Kapiyaw himanayak patatako nutakat ulukaya nang inak kami hiyok tuluang matakaw yung magapta. Angayok kangun na COVID, ihumalo te kang na COVID, ati nutakakayat, kapiyaw lawli, din na tokotigiyat, kapiyaw lawli, nuwang na raman, nilagay ko tayo yun. Nakangak linang may atwin naktalik, mass vaccination clinic, nahak kayo mayok talik, nunalik ka nang hak kayo tokak palayanak, so ni ublunik, agyatunik, taman na ikayong nakalaking mat,
Teresa Akeeagok, CBC News. My question is for the Education Minister. Inokshuk ilinyak vemme ilinyak ti ukaw jawlaw tui ipatcha siyama view tui nakahaknak mataggo February 3 ngotilogo suma khilamiunak sa mayo ukaw jaw ningilla. Inukshuk High School students were told yesterday that they may have been exposed to COVID on February 3. Why weren't they told sooner?
Juana, for that question about Iqaluit High School, I'm sorry, that's a question better answered by Dr. Patterson.
Thanks. It comes down to the timing of when we find out, and in some cases, people have attended social functions, school, work, or gatherings, and then realize later on they were sick, and it's part of the reason that it highlights that Omicron moves very fast. So the best thing that individuals can do is, if they feel sick, stay home and get tested.
Tana pejuti halua tu te ma hanga ko hauya katang mga tata ko sulu kati gitu minutillugi no kati gitu baloilin na bimi taman na Omicron hila me alu ser masungu ni kung ano te ma ser hila me alu katangat te ma kanim matu katwa kang kasi makata hui gata hauya sakta hui lutalo.
This question is for the Education Minister. Tusahatak si malaktagoa kau changit ni ang izokane asiagolo khinihatalekto e khitongay ni ilinya kaya khosichuti hakitaw zakko ohahatak si malaksutilo ilinya tulo rizikon ni sulizokichikon ni aksuti khanuilikon nakita kuno nga ang izokano. We are hearing from frustrated parents who are looking into online learning options so they can pull their children from school. They say they don't trust the Department of Education and are frustrated that your responses at the presser don't line up with what's happening on the ground. What message do you have to these parents?
Juana, for the question. I really feel like this is a time where we're all seeing new measures in place, and we have more communities than previous waves of COVID-19, where Omicron is, as has been stated by Dr. Patterson, spreading in different ways, and our schools, unfortunately, are seeing COVID-19, and our communities are seeing COVID-19 in different ways and spreading quicker, and hopefully we can get back to some normalcy sometime in the very near future. And I understand the frustrations that parents may face at this time, but I would say that it's best to reach out directly, for the parent to reach out to their teacher. We have 45 schools in Nunavut and over 10,000 students, and for each parent that may be facing some difficulty, it's best for the parent to reach out to their child's teacher to gain the learning packages and work directly with their teacher. Juana.
Mana yunutani malitawi hafto halat tiluga malame sunak saulat tilugi nunalin ni sama biusi mayino vajanak 19 min pilo hafto milo Omicron khila me alus sama sunguning ano tanaluta Patterson hakka majigi ngituk sama sung mataman nalo ilinnya binne sama gunak tunne khila me unak sakkullo time out utiko minaktu galo ino sir hatalo tino man nama kisani tako mamena galo ang yok hariya yo tamat suminga na masaw nga ta kisani ilinnya titsing no hawiga hatta naktu 45 matay na bino na bumiambalo 10,000 ng atani chitilin na ti time matako ilinnya titsiji ilinnya tingilo tako ilinnya titsiji mino hawiga hatta kuya yo ang kami ilinnya titsane pigo magay pata.
Trevor Wright, Nunavut News. Probably for Dr. Patterson. I was just wondering why the GN has stopped publishing exposure notices specifically for flights entering new communities.
Trevor Wright, Nunavut News. Kung nisama Nunavut government kung inita ko katiya hatuin na tuminutuin na kaya nisama how you kay hatang ilasulu hangata yuku tuminang ni nuwadyanak tulin ni.
Because it's counterproductive. And most, if not all, jurisdictions have stopped doing that a while ago because a number of things. Number one, if you've traveled, there's that risk of exposure. Number two, much of the risk in traveling is not associated with the time on the plane, but what the activities you take part in at the airports and on the rest of the way.
Taman nato te kalaron niyangat ilun nagalangin niyan kanata may abitos ma view unit taman na nukhat tao hatalit to how you kay nami katiya katoy nato minuga ham na kay luni tan na ilang apid duty luang to tamak ko kano sa mabview to na hatti minuning inni kamalolo ka nak to migut ham ning inni tay may matsulo ta ko hanga tayo mi tay masa mabview kayo luangin matakisan nila kano ilio ko singisulo utakibin ni balo ako tingin ni hanga tayo mi ngito lo ka nak tuminak sa katangata.
You previously mentioned mapping changes to contact tracing. What kind of changes are we expecting to see to contact tracing?
Wakawabita ko asid jata ulalam ni video tingi katiyaw yung minang nakawik kay hatang ni kano matataman na asid jilang.
That the contact tracing will be focused on the high-risk settings, congregate living, critical services, and minimizing the either the risk to those who are most vulnerable or the disruption to those critical services.
Taman nakatiyaw yung minang nakawik kay hatang nito agak luar nialak nakakawag kuluran at tuminak sanok. So long kami ukatigit dunod sulun nakubindok kayam balupin makiyo yun na pijit sa raw te karelin no tamakolo kaya naktumin naksagun naktunod aga ham naksaw na lang at kawya sa katang na mo katiyaw to nakaliminan.
Matsi Survey, Radio Canada. So there is currently 366 reported cases and 19 hospitalizations. So this means a ratio of approximately 5 hospitalizations per 100 cases. What can you tell us about that ratio? What does it tell us, and how does it factor in your decision process to easing measures?
Matisse Harvey, Radio Canada, kung 366 ngulat tilugin ubad juan ak tulit 19 ngulut unit si mayuan na binni takwagu solo talimaw mata unihatak 200 Nick, I don't know what else.
So it's 19 hospitalizations out of 1,300 known cases. Those 19 hospitalizations, that's the number. It's the total since this current wave hit. And like every other jurisdiction, with all the changes, we are not capturing by any stretch of the imagination all of the cases of Nunavut catching COVID in the territory.
Ako 19 unit si mayan na bin ni 1,300 ngos si mayuni tamakuningan ni badjuan na taas si mayuni. Tako akatilog itaman na sama palya New York pigalaw sa manik kay machay na kanata mi asingin tamako si jakta katalang ngata nasakta yun na hatta unni ngata no na bumita makko no badjuanak nang hintas si mayugalwa ilon na chi.
So given those weaknesses of the numbers, what we look for in determining the measures is the load on the system and the outbreaks amongst vulnerable groups and critical services.
Tamakwa hatsiw ning inni atang yapto ni kawya katakun ni tinno tay may makawya gaswa nga katak gutakwa kanutigi abyan na ham na mga tapili reduce ugalin ni kamalo sa maktoham na katamak kuninga uluganak tumilo ang naksanot amalo pijit sira utaw gaya kalakit tuno tamakwa tuwi na hang nakatat tamakwa kawya sa naksari nga katalikat tigo.
And last, we're watching each community for that really rapid growth that was seen in Iqaluit 2 weeks ago as an indicator that it's time to bring in more strict public health measures.
Atautsiku seama biuyum matamisuni makku pinasarusina naasimalektu taima tamakkuninga haujigaigata seama palliajuni khilamikku taakwa
Since yesterday, teenagers aged 12 to 17 years old in the Yukon, as well as immunocompromised children between 5 and 11 years old, are eligible for boosters. What's your plan for booster rollout among children and teenagers here?
Takwa dosang maximum mokiuli 12 me 17 no Yukon me amalo takwa timi migwana majute haloang itu takwa pingayon ni kapayaw gunam na lang at takhanuli taman na pangnaw tiyo sumavasuro sirnot uvikan nulo taman ni kapayaw hatang na mga tapingayon ni
12 to 17-year-olds have been eligible for boosters for quite some time across the board in Nunavut. So they're eligible for a booster 6 months after their second dose. For the children in the other group, we will follow with NACI's guidance and provide a third booster for those who are immunocompromised at the same time frame that they recommend. But that age group is getting their second dose in the last week or two. Most of them have become eligible. So we've got a fair amount of time to sort out for the rest of the general population if they need boosters. Sorry, the general, the rest of the children in that age group, I should say.
Takot ukiuli 12 me 17 mo kapayaw gum naksimayo ako niulak tuno na bumi pingayon ni kapayaw gum nakatang at takhi 6 na alaw tilugi tulian ni kapayaw law tilugin so kusi tako solo kanim masakay gum naktutubalo anna majuti khatyang itu timimigo tamakwa kapayaw simalak tugalo amisu naksay tuliani kisani ta napibikam na katasuli tako nalunayak taw na tilugin
Kent Driscoll, APTN National News. Dr. Patterson, how many Nunavut are currently in hospital from COVID-19?
Kent Driscoll, APTN Nunavut Unichimayo.
I don't know the answer to that. We follow the total number. I'm aware of at least 2 that have been transferred to the south in the last 3 or 4 days, but there may be others that are still in hospital in the south.
Dr. Patterson, right now our neighbors over the NWT, they're reporting several outbreaks in schools. Now, we haven't heard that from your government yet. I'm wondering, how many cases would it take to declare an outbreak in a school? And if there was an outbreak in a school, would you inform the public?
Dr. Patterson, taiko sanili bununat sa ami. Nalo na si samalang atajiging ito ni sa magbiyo yung hangsimaning inilin na bini. Taman na nalo na taulong imbali no na bumi. Katsiulik katalita ma sa magbiyo yung ilin na bini. Nalo na siguna, nalo na silaki.
It would take at least like 5, we'd probably hold it at 5 cases in the classroom or significant transmission within the school itself. When we identify that sort of an event, yeah, we would go public and say it's an outbreak localized at that school and close the school or close certain classes for a set period of time.
Tali maulik katasulu ilin na bimi khatigi ko sa makbiyo si mayot. Ubalo ni sa maktokalakid sa malaki lang na katamis yun. Tai manalo nang siga yaktu gusia makto kalam ningan ilin ner binni matu jau ga yaktu balu ila nang ilin ner ti matu jau ga yaktu.
But again, it gets to that difficulty in figuring out did the transmission happen in the school, in which case it's appropriate to close the school, or did transmission happen at other social gatherings amongst that same age group? And we've seen, especially in the last week or two in several communities, that overlap is considerable.
Digi hatang itu solo sa makto ham na kailin na biwilo ani dai manalo na siga yaktu how yikailo ta dai ma solo at ilin na bimitong itu sa mabiw hatang at tamakwa ka go hatigi nalo na hatang nalla nila ta ilin na bimi balo ni sila ta ni sa mabiw ng mga tataman na nalo na simaluang ito.
Teresa Hetchuk, CBC News. My question is for Minister Gross. Ukakatak tutitak ko ang izokha kaungelio ko tihak pata ilinya tichizino kunaktwe khanok letak ko ilinya tichizid ikazok kisio ilinya tulrizik kunningaklose. You've just told frustrated parents to direct their complaints to teachers. What do you have to say to teachers about how your department is supporting them?
Juana, for the question about teachers, first of all, I'd like to acknowledge all of our teachers across our territory who are working very hard during this pandemic and working to ensure that our students are receiving material, whether at home or in class. And I do sympathize with the situation, as every community is different, and every day there could be different notices going around. The Department of Education has a little bit of a different system when sending out information and disseminating information. It goes from the Department of Education through to the school operations, the regional school operations, then to the principals and teachers. And right now we have a lot of information that has been shared through this process on how to deal with and manage through these tough times that we're going through with COVID-19 and the regulations. We also have devices for staff and to use those devices at home when needed, and including laptops and the Wingle sticks.
Ay mayugili sa kaya kailailin natin sa jilimano na bumiyats piliri yung marius si mama tataman na siya mapalatin lugo. Tako ato tihat siya tumi ikayong na hamata tako alo ipigit siya takano nalilo adjigi hatangin mata tako ilin nato liri ko adjigi ngitumi piliri jut sa kangata hano to saktit sa hatam mga ata ilin na tuliri kunik ilin na binno dawlat sa yino si takot amalo ilin na binangayok haraya yuno ilin na tit sa yino lo tamak ko to saktit siguti o hatta to hano kamagya ha mga ata no ba jo anak tuliri ng mot amalo hano ito ni malitaw yigalin ni pita ha mga ata.
So thank you for the question about teachers, and I know that this isn't an easy time, and we will relay on more information back through the chain about remote learning and questions that have come up during the presser about packages and specific questions in regards to parents reaching out, etc. So Kwana for that.
Kaya namik tako ilin na titsi pijuti gilugi tako to sak titsi akan ni hatalang ayugut amalo tako ilin na ako timit sano ang ikaw jagum nakto ni tako to sak atak tabo apik kuti yo ang ikaw tigat sanik tako ang ayok hakaya yun to sak titsi kuti hatalang ayui.
David Venn, Nunavut News. I believe this question is for Dr. Patterson or the Health Minister. It's from a resident in Cambridge Bay. They live in a 2-bedroom home with a family of 7, including 2 kids who are too young to be vaccinated. The parents are hesitant to send their kids back to school because if they get COVID, there won't be room to isolate at home. They are asking if the Department of Health has plans to help care for entire families if they get sick.
David Vernunat sa kumnikta ko Iqaluit sa mi mapik putiyo. Ako iloko sila ni makoy na ni 7 ngulutik. Ako mako hito ngangi kapiyaw nang itu kilo amo. Ako kanim mato katwa ka ani tailwit sa hakayang mata na ham nang itu lagi ko kano. Ikayo kaya tamak ko so lo kanim mato minum patay lo meo katigiliman.
Kiugaya lau kalungan Dr. Patterson ilagayang na magutaman na. Ihumalo tigi yangit. Ikping nak tu galo itu kihin na chapter ho ihumalo gayak mga tay lagi yaw yut. Taman akong na tolra ngo himapmat nuwang na lura larinak. Ami hunun. Iglora kikang na kayabut. Nunavu iluani pidjutaw taklo nila ngagut. Kau yung mayungan lo hibulak tigi yabut. Tamat tumingaw kau hekak tau yain nakmat. Taman na tukihiyo mayaw wadlia yuyak magin na to gabumatoka kunun amigak hilakay kapta igloluanik pilakajinik adjiging itu ni amigak hinak takakman kiglekak tuluk ta ang bluti atuin now yut ubat tinu gabumabluta iglokak tin nayak mangap tigu nang minang ilagi yaw yut kiu ni ayok tunga kihiani Iqaluit gaya kayak tu galuite ko at nila kayang napata ni kaitigut umbalun ni ahegut Iqayok daw ni lugya kayak tu galuit kihini ay himalut tiu ay himatitaw gaya kakayang ng lahat at nila kayang napata. So all of our response on COVID has been situation of dealing with limited resources. We're limited in what we have on the housing stock, and I know that our Premier has pointed that out repeatedly at the federal level in terms of the health impacts that our ongoing housing crisis has. And we also have limited human resources in terms of health support that we can provide. And so that's the context of what we're trying to operate and what we're operating here. In that specific case, it would likely be that the family would have to isolate at home. They could be supported by the government, things such as food hampers, such as virtual public health advice, but that would likely be the scenario. And I really do sympathize with the family and understand why they would be concerned, because it is a very stressful time for many Nunavut. What now?
Thank you, everyone. That brings us to the end of this press conference. As you know, we've moved to one press conference per week. Therefore, our next one will be on Tuesday at 11 a.m. If there is any other news in between, you'll receive news releases informing you.
Ako may kaya min mata nagkadyaw lakimita kut sa kanila aktuit. Asya gusto sa kat sakta hakka to sakti sa kat talaga yesi.